Welcome to our low back exercise video. When we've had persistent or long-term pain, we often reduce the amount of exercise or activity that we do and can become stiff and lose strength, causing a cycle that can actually lead to increased pain. Remember that movement is good for our bodies. Our joints and muscles are made to move. Movement and exercise can help our muscles stay strong and our joints flexible, and can also reduce your volume switch of pain. You may wish to choose just one exercise to begin with. Work out which level of exercise is right for you to start. In other words, try to find your baseline, the amount of exercise or repetitions that you can do that doesn't give you a flare-up of your symptoms. Start off small. It may be that you do 1 or 2 repetitions to begin with. Then as you gradually gain in confidence, you can start to build more. You can gradually increase the number of exercises that you do. Aim for your exercises to be sustainable. This will help you to avoid booming and busting. So try to avoid doing one big session in a week, because this might set you back for the next few days. If you notice an increase in your symptoms, you may need to decrease the number of exercises that you do, or go back to the easier level for a while until symptoms settle. Lisa and Steph are going to take us through a set of leg exercises. These exercises are good for stretching and strengthening your legs and glutes, helping with activities such as getting up out of a chair or walking or going up and down stairs. So let's get going. These exercises are good for knee and leg strengthening. Lisa is to the left of your screen as you're looking at it, and she will be showing us how you might start these exercises. Steph to the right of your screen will be demonstrating the slightly more challenging movements and exercises with a slight progression. The first exercise is straightening your knee. Lisa is straightening her leg to the position which is comfortable for her, then returning her foot back to the floor. Steph has gradually been able to increase this movement and can now straighten her leg. You can also bring your toes back towards you to give you more of a stretch through the back of your thigh and calf muscle. The next exercise is to stretch the back of your leg and your hamstring, sitting safely just slightly towards the front of your chair, one heel on the floor in front of you. Lean forward with a straight back to feel a comfortable stretch behind the back of your thigh. Lisa can't quite fully straighten her knee and only leans forward a small distance. Steph can lean further forward to get a slightly stronger stretch. With this mini squat exercise, Lisa and Steph are holding onto a stable surface to ensure they are safe. Lisa is slowly bending her knees, just a small movement to start off with. Steph has gained some confidence and strength over the weeks and is now able to do a slightly bigger movement. You're likely to hear clicking noises with most of these exercises. This is really normal. This hip strengthening exercise is useful if you struggle to get in and out of a car or bath or upstairs. Sitting on a chair, you can see Lisa lifting her leg up off the seat, keeping her knee bent. You may need to support your leg with your hands to begin with, while you build up your strength over the weeks. Steph is now able to do this exercise in a supported standing position, holding onto a stable surface, and lifting her leg up as though she is marching and exercising both legs. For this next exercise, Lisa is sitting and is just taking a step out to the side. Steph is taking this a step further by sidestepping from side to side. The next exercise is the calf raise. Lisa has chosen to start in a seated position with feet on the floor. She just lifts her heels off the floor and slowly brings her feet back to the start position. Steph is doing this exercise with her feet hip-width apart, holding onto a stable surface. She pushes up onto her toes and slowly returns to the start position. This exercise is to stretch our calf muscles and is the last exercise in our leg series. Lisa is safely sat towards the front of her seat with one leg in front of her and her heel on the floor. She's just pulling her toes back towards her to feel a comfortable stretch through the back of her calf. She can also use her dressing gown cord, or you could use a belt to aid the stretch. Steph can do this stretch in standing, with one foot behind the other, with a straight back leg and a bent front knee. She leans forward to feel a comfortable stretch in the back of her calf.